We chose to do case 8, which is how Mayo Clinic uses AI to enhance our programming for healthcare. Mayo Clinic is the largest not-for-profit medical group in the world. The company was founded in 1889 in Rochester, Minnesota by Dr. William Morrell Mayo, the Sisters of St. Francis, and Mayo's 2 sons. The medical group has maintained a focus on group work ever since it was created. For example, the company brings in teams from many different medical fields to help with research and provide patients with care. They also have 3 schools in Florida, Arizona, and Minnesota where students help with researching diseases and trying to provide cures for them. Mayo Clinic uses R programming, which is a tool used for statistical computing and data visualization to help organize all of the data that they collect. They also integrate AI into R programming, which allows them to analyze patient records and predict outcomes. With this tool, Mayo Clinic can provide an early diagnosis and treatment for disease. AI integrated R programming also allows them to identify genetic markers for disease, create interactive dashboards to display the data sets that they collect, and compile patient feedback in order to provide better patient experience and better patient care. Ever since adopting R programming, Mayo Clinic has been able to enhance medical care, accelerate research, and reduce the time and resources required in a clinical setting. The introduction of AI and R programming also came with some challenges, such as data integration requirements and figuring out how to keep improving to remain among the top medical groups in the world.
Mayo Clinic is facing one of the biggest challenges in modern healthcare, integrating massive amounts of diverse medical data into a system that actually works for clinicians, researchers, and patients. With the rise of artificial intelligence, they realize that AI isn't just a useful tool, it's essential for long-term success in healthcare data. Today, there are so many different places that you can get this information, such as electronic health records, medical imaging systems, online patient portals, and handwritten clinical notes. All they contain valuable information, but bringing them together into one unified system can be difficult. That's where Mayo Clinic platform comes in. It's designed to merge all the different data sources into one single cohesive system. Using Mayo clinical and operational expertise to help make sense of extremely complex information, their chief operator officer, Manheesh Gold, puts perfectly when he says, "When we share knowledge, we make better decisions." This reflects Mayo's larger goal of not just using AI, but using it in a way that supports ethical and informed decision making for patient care. One major part of this effort is Platform Connect, which manages a huge amount of global health data. To give you an idea of the scale, there's about 26 petabytes of information. More than 1.6 million of that is clinical notes, around 6 billion is medical imaging, and 3 billion is in lab results. AI tool processes information in record time. For example, the AI record tool can extract and analyze everything from the types of PDFs to handwritten notes, making those records instantly usable. Another powerful tool is State Viewer, which helps neurologists compare the patient's brain scan to thousands of previous cases. It automatically identifies the 20 most similar patterns, making diagnosis faster and more accurate. This is crucial because there are nearly 1 million dementia patients in the US and only about 500 behavioral neurologists. State Viewer has helped close this gap by giving doctors a better tool to support their expertise. On top of this, Mayo uses R programming combined with AI to analyze patient data. This helps identify patients who are at high risk of readmission or complications. Using R tools like ggplot2 and Shiny allows Mayo to help build interactive dashboards that turn complex data into simple, useful visuals. This improves research, support operational efficiency, and allows clinicians to focus more on patient care. But technology can only go so far without proper training. That's why the Harper Family Foundation's AI Education and Medicine program is so important. By combining their platform, AI tools, R programming, and strong staff education, Mayo Clinic can overcome these challenges of data integration. And because of this unification of healthcare data, they're improving diagnostic accuracy, personalized treatment, and strengthening their leadership in medical innovation.
When we talk about using AI in healthcare, one of the biggest challenges is making sure that the models are easy to understand for doctors and nurses who actually use them. If the AI just spits out a number or a prediction without explaining why, then it's really hard for doctors to trust that. That's why interpretability is so important. Mayo Clinic can improve this by using models that are already more transparent, like decision trees or linear regression, instead of always relying on the results. For example, if the model predicts that and sees that there's high blood pressure and cholesterol levels were the main reason for that prediction, it makes the AI feel less mysterious and more like a tool that supports the doctor's own judgment. At the same time, Mayo Clinic can use special techniques to explain complex models when they do need them. Models like SHAP or Lyme can break down predictions and show which variables mattered most for each patient. This is helpful even if the model is complicated. Doctors can still see the reasoning behind the output. On a bigger scale, the global expansions like feature important graphs or partial dependent plots can show how the model behaves across all patients, which helps researchers check if the AI is making sense or is it just biased. Mayo Clinic has also been working on something called hypnosis-driven AI, which means they design models based on medical knowledge and not just random data patterns. This makes the results more meaningful and easier to connect to real science. Another way to make AI more understandable is to show uncertainty and confidence levels. Instead of just saying this patient will have a complication, the model could say there's like a 70% chance of complication based on the risk factors. That way doctors know how much to trust the prediction and can use it as part of their own decision making. This would make it easier for doctors to interact with the data and see the reasoning behind the AI's prediction. Finally, documenting models with model cards that explain what the model was trained on, what it's good at, and what limitations it's limited to, would keep everything transparent and safe. By combining simpler models, explaining explanation tools, clear communication of uncertainty, and good documentation, Mayo Clinic can make sure its AI systems are not only powerful but trustworthy and easy to use in real healthcare settings.
To number 3, healthcare institutions can balance innovation with regulatory compliance when using AI and R programming to analyze sensitive patient data by focusing on strong privacy and security from the start. Because patient information is extremely sensitive, organizations must use a privacy by design approach, meaning protections are built into the AI system from the earliest stages. This includes using privacy-preserving tools such as differential privacy, federated learning, and homomorphic encryption, which allow data analysis without exposing individual patient details. These methods help keep sensitive information inside the institution's secure environment. In addition, any patient data used in AI or R programming must be thoroughly de-identified, removing or masking all personally identifiable information while still keeping the data useful for analysis. At the same time, healthcare organizations must follow major regulations like HIPAA in the US and GDPR in Europe. These laws have strict rules for how patient data can be stored, shared, and protected. To stay compliant, institutions need strong data governance frameworks that clearly define ethical data use, access controls, and security requirements. When AI systems are used for diagnosis or treatment, especially systems that continue learning over time, extra oversight from regulators like the FDA may be required. This often includes tools such as predetermined change control plans that help manage updates to AI models while keeping them safe and compliant. As AI evolves quickly, policymakers also need to develop new guidelines that protect patients while still allowing innovation to grow. Finally, responsible use of AI depends on ethical and operational accountability. Healthcare organizations must make sure algorithms are transparent, fair, and regularly checked for accuracy and bias. This includes testing training data to ensure it represents diverse patient groups and does not reinforce healthcare inequalities. It is also essential that healthcare professionals remain the ultimate decision makers, using AI as a tool, not a replacement. Detailed documentation should record AI recommendations and explain why a clinician accepted or rejected them. Ongoing monitoring, secure environments, and strong ethical oversight help ensure that AI systems remain compliant, safe, and effective over time.
In conclusion, Mayo Clinic's use of AI and R programming helps them to bring together the large amounts of data that they collect, turn patient feedback into notes that they can use for improvement, and helps them provide transparent data models for physicians and patients to use. Thank you for watching.